We'll get started with our meeting for today. I want to welcome you all to the Arizona J1 Visa Waiver Program's stakeholders meeting. First, I want to say thank you to all of those who submitted their questions through the SurveyMonkey link that we provided. I want to introduce myself. My name is Anna Rossetti, and I'm the Workforce Section Manager here at Arizona Department of Health Services. I am the Program Manager for the J1 Visa Waiver Program. With me here today is a group of people that I'd like for them to introduce themselves.
Hi, I'm Patricia Tarango. I'm the Bureau Chief, and I am Anna's Direct Supervisor.
Aubrey Joy Corcoran, Health Unit Chief at the Arizona Attorney General's Office.
Molly Bonsall, Assistant Attorney General.
Nancy Darbiella, I assist Anna.
Diane Williams, in here for technical support, direct report to Patricia Tarango.
All right, thank you. So you should have received a copy of the agenda that we sent out, I believe, on Monday. We will cover briefly an overview of the J1 Visa Waiver Program, and then we'll go over the responses to the questions that we received through the survey, and then the final item would be next steps. Our webinar today will be recorded, so for those of the stakeholders that are not able to attend today, we will send them, and of course we will send you all the link to the webinar recording. The lines will be muted throughout the presentation. If you have any additional questions, if you can please type them in the chat box, and we will collect the questions later. We will review them, and then we'll provide you the responses at a later date. Of course, you may also email me through my email, and most of you already have my email, I'm assuming. Email me, and I can certainly include those questions when we send out our responses to the questions that we will collect today through the chat box. All right, so we are going to begin our presentation. I'm going to start by just providing you some data about the workforce shortages in Arizona. I think it's important to provide some perspectives on the shortages that we have here in the state. So you can see we have over 1,000 providers that we need in the state of Arizona. A number of them are primary care health professional shortage areas, about 155, and we currently need about 442 primary care physicians. And then for mental HPSAs, we have close to 100 mental health professional shortage areas, and we need about 204 psychiatrists. You can also see that we are in need of a dentist in the state, about 440, and the current number of dental HPSAs is about 172. Here is the map of the state of Arizona, and the colors that you see there are all of the primary care health professional shortage areas in the state. And you can see about 80% of the state of Arizona is in the primary care HPSA. So the different colors that you see just represent the category of HPSAs that an area can receive, but in general, any J1 physician who wants to practice in the state of Arizona can select any of these areas that are colored and potentially apply for and receive a waiver through the Department of Health. Here is the map of Arizona with the mental HPSAs in the state. As you can see, the entire state of Arizona is in a mental health HPSA. So a J1 physician in the discipline of psychiatry can essentially work in any areas of the state. And if the service site meets the requirements of the program, then potentially that J1 physician psychiatrist could apply for and receive a waiver through the State Department of Health. So there was a study done by the U.S. Department of Health and Human Services, I think about in 2014, and they talked about supply and demand, accounting for the different factors. For example, aging population, the growth in the United States, and as well as some increase in healthcare utilization, specifically primary care utilization, as a result of the Affordable Care Act. Specifically here in Arizona, Obviously, there's an increased healthcare demand as a result of the Medicaid expansion, as well as the increased insurance rate brought by people who are actually who sought healthcare coverage through the health insurance marketplace. And here you can see the projections by 2030. We will need about 1,941 primary care physicians by 2030. So I'm assuming that most, if not all of you, are familiar with the J1 Visa Waiver Program, but just a brief background. That J1 Visa Waiver Program was enabled through a congressional act, the Conrad 30 program, that was created in 1994. And Conrad 30 program was created to help rural underserved communities recruit primary care providers. In Arizona, the Conrad 30 program is called the J1 Visa Waiver Program, and our goal is to improve access to healthcare services in underserved areas of the state. So what we do here is we act as an interested agency to support a request for a waiver of a home residency requirement from a J1 physician, either a primary care physician or a specialist who commits to serve in underserved communities full-time for at least 3 years. The sole authority to authorize the J1 visa waivers is the U.S. Citizenship and Immigration Services. So while we review the applications here, we assess whether an applicant and of course the service site meets the requirements of the program. We do not necessarily approve the waiver. It is only the U.S. Citizenship and Immigration Services who can do that. Arizona J1 Visa Waiver Program gives priority consideration to primary care providers, and primary care is defined as a J1 physician in the discipline of family medicine, internal medicine, OBGYN, pediatrics, geriatric psychiatry, and of course there are hospitalists who are internal medicine working in a hospital setting. There are 30 slots, as you know, are available per year, and 22 of those slots are dedicated to primary care, 7 for specialists, and 1 discretionary slot for our agency to use. There are federal requirements per the Immigration Nationality Act Section 214L that we have to ensure a J1 physician meets in order to receive a waiver through our program. So the J1 physician must demonstrate full-time employment at an eligible healthcare facility, and that employment is deemed to be in the public interest. The J1 physician also has to agree to practice primary care or specialty medicine in an area or areas designated by the U.S. Department of Health and Human Services as a health professional shortage area, a medically underserved area, or a medically underserved population. The J1 physician also has to agree to begin employment with a healthcare facility within 90 days of receiving a waiver and must continue to work at that an eligible healthcare facility for a total of at least 3 years. Of course, we know that if there's an extenuating circumstance, then that physician could transfer to another eligible site upon approval from the USCIS. There are additional state requirements, and this is an authority that the states have by administering the Conrad 30 program, that we can actually implement additional state requirements. So here in Arizona, the additional state requirements are the following. The J1 physician, first of all, must be eligible for an Arizona medical license. The physician has to agree to charge patients at a usual and customary rate for health services in the area. It has to agree to serve everyone regardless of the ability to pay. And that means that they have to serve regardless of what the source of payment is, so be it private insured patients or government insured patients that include state Medicaid or what we know here in the state of Arizona's Access, Medicare, Kids Care, and also if a person is uninsured, low income at or below 200% of the federal poverty level guidelines, the physician has to agree to implement a sliding fee scale. The only exception to the sliding fee scale requirement is if a physician is working or employed by a hospital setting or by a hospital, or if a person is working in a state prison. Other than that, everyone participating in a J1 Visa Waiver Program has to have and implement a sliding fee scale. Also, we here in Arizona require the certain provisions in the physician's contract upon employment, and that is that they have to provide full-time employment at least 40 hours per week or a total minimum of 160 hours per month at an eligible healthcare facility. They have to, the contract has to indicate the physician's scope of practice or discipline. So for example, if a physician is practicing family medicine or psychiatry or a specific specialty, they have to indicate that in the contract. The contract has to include the name of the facility as well as the address of the facility. It cannot include a non-compete clause, and also it cannot include a termination by utility. So essentially, the contract could only have a termination for cause. And in addition to that, we require a verbatim language in the contract, which stated in the, hopefully you have access, you can see the slides, and it says the J1 physician and employer may not change by contractual amendments or otherwise essential terms of employment contract as required by ADHS J1 Visa Waiver Program. So in addition to the physician requirement, we also have requirements specific for the service site. The main requirement really, which is a federal requirement, is that the site has to be in a health professional shortage area, a medically underserved area, or a medically underserved population. In order to be eligible for J1 placement, the service site has to be operational for at least 6 months. And the site has to demonstrate that it has unsuccessfully recruited for the position being hired for at least 6 months prior to submitting a J1 waiver application to ADHS. The service site also has to charge patients the usual and customary rates for health services in the area, must agree to serve everyone regardless of the ability to pay, implement and charge a sliding fee scale for uninsured low-income at or below 200% of the FPL. It has to have a policy in place for the sliding fee scale program and must post a notice of the discount or the notice of the sliding fee scale in an area that is visible to the public. In order for the J1 physician to be eligible for a waiver, the application has to be submitted within the time frame specified. So currently we require that, right now our cycle is open from October 1st to November 30th. So only applications submitted or postmarked within that time frame will be accepted. The application has to be complete. Both the physician and the service site demonstrate meeting both federal and state requirements. And then, in addition, our waivers are limited to 2 J1 physicians per site per year, although ADHS may waive this requirement if there are slots available to be filled during the fiscal year. Now, if more applications from primary care or more applications from specialists were submitted or received here at the department than the slots that were allocated, then ADHS does have a prioritization criteria that we use to determine who among the applicants are supported first or need to be prioritized first. So the prioritization criteria include the geographic location, so urban versus rural. Rural providers are given preference over urban providers. The service type, the language, other than English, is predominant in the area where the person is, where the J1 physician is going to serve, percent of services on sliding fee scale, the distance of the site to the next nearest sliding fee scale, and the facility type. This is not an all-inclusive list. There are some other items that we use, but these are just examples of the factors that we look at. Waivers are not for J1 physicians and research physicians or those practicing in long-term care facilities, chronic care facilities, or rehab facilities. This is a screenshot of the J1 Visa Waiver Program checklist. You've seen this probably many times before if you have submitted an application to ADHS for, for a number of your clients. But mainly, the checklist is clear. It provides a number of copies of the documents that's required, and it tells you to affix the case number on each page. And believe it or not, we still get applications without case numbers on each page, which we'll have to return or figure out how we can get those case numbers on each of the document page. You know, the first seven documents require 2 copies. And those are the documents that we actually submit to DOS, to the Department of State. And then the items 8 to 14 are documents that we actually keep here at ADHS for the physician's chart. So I can't stress enough, you need to study the checklist and make sure that you follow the instructions. For example, if the items state specifically, for example, for the recruitment efforts, it says that you have to submit a narrative of your recruitment efforts and also submit supporting documents. So there are 2 pieces to that item, to that specific item on the checklist. So make sure that you submit whatever is required per the checklist. And then I'm going to briefly talk about the National Interest Waiver Program, which, as you know, is almost like an extension of the J1 Visa Waiver Program. The NAW program, of course, is a program that we have been administering here in ADHS, and it allows certain foreign workers, including foreign physicians with exceptional abilities to work in the United States. And the states, like the Department of Health, can recommend a national interest waiver on behalf of that foreign physician. We basically, just like the J1 Visa Waiver Program, act as an interested agency attesting that the foreign physician's work is in the public interest. And in the past, we have only allowed J1 physicians who have been supported by ADHS and those that are in rural areas and primary care physicians to be eligible for the NIW support. We have since in 2014 removed the requirement of rural and primary care physicians only, but we have kept the requirement of the physician serving at least 1 year in the HIPSA in an eligible service site immediately, at least 1 year preceding the request for NIW support. But the requirement for the NIW is that the physician has to serve an aggregate of 5 years. So that 5 years includes the J1 Visa Waiver obligation of 3 years. So it's an additional 2 years from the end of the service obligation of J1. And the physician also has demonstrated that he or she has complied with the ADHS J1 Visa Waiver Program policies. So this is a slide that shows you our total obligated J1 providers in the state of Arizona. Currently, we have 91 active providers. You can see that we have more primary care physicians out in the field than specialists, 51 primary care versus 40 specialists. But in terms of rural-urban distribution, you can see that there's about 60% of our providers in the urban area and about 40% in the rural area. In terms of the number of applications over the last 10 years, you can see that we are one of the competitive states in the U.S. That actually in general have no problem filling our slots. You can see that there are only 4 years. Those that are in red dots, you can see those are the years that we have not been able to fill all 30 slots, but in general, we have been filling our slots. And that's it for the overview presentation. We are going to move on with the responses to the questions that were submitted to ADHS. So what we did, we actually received a total of, I believe, 17 or 18 questions, and what we did was we categorized them into 4 buckets. Some of the questions were program policy questions, some of them were service monitoring questions. There were questions related to application review process, and then contract questions. So we're going to basically cover the program policy questions. So these are the questions that we received. I'm going to start with the first one. Are there any plans to expand the program to include senior centers and long-term care facilities? So there was a background information that was submitted with this question, and that background information actually cited that ADHS published a report in 2014, and it's called the Aging in Arizona report. And in that report, it cited that there is going to a projected increase in the number of elderly population in the state by 2050, which is an increase of 174%. So while ADHS is of course aware of that report and the projected increase in the elderly population in the state, the program's focus will continue to be on increasing access to primary care services for the community at large. So at this time, ADHS is not going to expand the program to include senior centers and long-term care facilities. So the second question reads, would ADHS consider adding the FLEX program to the Conrad 30 program in Arizona? So I have just provided you the overview presentation where it talks about the shortages in the state of Arizona. There is a significant shortage in the state. What I did not mention in my overview presentation is that in Arizona, there's a number of health centers, community health centers. There's 220 sites that our primary care physicians can actually potentially find placement to. So we have a shortage of primary care providers in federally designated health professional shortage area. So at this time, ADHS will continue to support only J1 physicians in those health professional shortage areas. Is the 2-doctor limit per hospital or per healthcare system? For example, multiple hospitals are affiliated under the same brand but are separate hospitals, such as Banner or Honor Health or Dignity. So the current policy is to support 2 J1 physicians per service site per year. ADHS defines a service site as a site where the services of a J1 physician are going to be delivered. So a healthcare system may have multiple sites, and a physician may apply for and receive approval from the United States Citizenship and Immigration Services to work at multiple sites. But a J1 physician may only work at sites that were approved by USCIS. The fourth question, would ADHS consider removing the limitation of 2 physicians per site, or at the very least, increasing the maximum number of waivers per site per year? Actually, the current policy, as I mentioned earlier in the previous question, is that ADHS will support 2 physicians per site per year, but that ADHS may waive that requirement if slots remain available during the fiscal year. However, you have to bear in mind that a support letter is not guaranteed for any J1 physician applicant. Employers may, at their discretion, submit more than 2 applications per site during an application cycle, understanding that ADHS will adhere to the site limit per year unless slots remain available. So what we're going to do is we're going to clarify this requirement further on our website. The fifth question, would ADHS consider removing the requirement of 1 complete year of service before it provides an NAW support letter to a J1 waivered physician? So the intent of the 1-year requirement is for ADHS to ensure 3 things. One is to increase access to care in the underserved area, resulting from the J1 physician being granted a waiver through ADHS support. The second thing is that ADHS wants to ensure continuity of care for patients being served in the underserved area by the J1 provider. And we also want to ensure that the physician has demonstrated good conduct by complying with the requirements of the J1 Visa Waiver Program. At this time, ADHS will continue to implement this one-year requirement. And then the last question, what if any changes are coming? ADHS does not anticipate any changes to the program. So the next set of questions is related to application review process. The first question, what is the biggest item that causes requests for more evidence? And then what are some common deficiencies in applications? So we're going to respond to both of those questions. So we actually pulled data from applications received in 2015 and 2016, and on average, about 55% of the applications lack or have insufficient recruitment documentation. And then about 40% have incomplete service site applications, and that includes either the data table on the percentages for underserved populations were missing, or there were missing signatures or notary. 38% have contract issues, and 25% have missing sliding fee scale documents. We can, if there's an interest for technical assistance related to the J1 Visa Waiver Program requirements, I can certainly provide that technical assistance later. Also, you can contact me for any questions you have about the requirements. What makes an application stand out? All applications are reviewed for administrative completeness and compliance with program requirements. Only applications that meet both are considered for J1 waiver support. So the fourth question, it just says recruitment requirements. So I'm assuming that this is asking what our requirements, what our recruitment requirements are. ADHS requires that an employer has recruited unsuccessfully for at least 6 months prior to submitting a J1 waiver application on behalf of a J1 physician. ADHS requires that the employer demonstrates its unsuccessful recruitment efforts by providing a description of the recruitment efforts, and the description has to include the number of candidates who responded to the recruitment effort, the number of candidates that were interviewed, the outcome of those interviews. In addition to that, the employer must submit an evidence of recruitment that includes dated, print, or online ads, and other supporting documents showing that the employer has made a good faith effort to recruit a U.S. candidate but was unsuccessful. Fifth question, letters of community support. Again, I'm assuming that this is asking for ADHS to clarify our requirements for the letters of community support. ADHS requires 3 original community support letters on appropriate letterhead from organizations or members of the underserved community where the J1 physician is being recruited, who can certify the need in that community. And that person is writing in support of the J1 physician being recruited. So essentially the letters of support should not or must not come from members of or affiliates of the sponsoring agency or service site. Some examples of letters of support are county health department support letters. You may approach the hospital associations. There are some partner organizations you work with, community health centers in the area, some professional organizations, or faith-based organizations. So there's a lot of agencies that can provide a support letter on behalf of that J1 physician, as long as it's not affiliated or, you know, members of the sponsoring agency or service site. The sixth question, all immigration documents pertaining to a J1 physician should be copied forward to AZDOH, and employers should fully cooperate if any such information is requested by Dr./DOH. So I'm assuming that this is asking whether all immigration documents pertaining to a J1 physician are forwarded to the Arizona Department of Health Services So the answer is that all documents necessary to apply for a J1 waiver support through ADHS must be submitted. Currently, employers or the representing attorney, in coordination with a J1 physician, submit all the required documents to ADHS to be considered for a J1 waiver support. There are specific documents that are required from the employer, and then there are specific documents that are required from the physician. But in order to submit a complete application, both the employers and providers, with assistance of the representing attorney, if there's one, must work together to provide the necessary documents to complete the application. The 7th question, timeline when a decision is made for each cycle. The ADHS application review process generally takes between 8 and 12 weeks from the end of the application cycle. So the review and processing period really depends on the number of applications received and the quality of those applications. ADHS has always worked diligently, though, to review applications and send notifications within a reasonable time frame, which is typically less than 8 weeks. Once ADHS has made a final decision regarding the application, ADHS then notifies the attorney on record and the provider. If there are spots remaining after the November 30th deadline, then ADHS may open for a second cycle or a third cycle to solicit more applications. We have one question related to contract requirements, and it reads, termination for cause should have a requirement for a 90-day notice and term for cure. This will ensure that J1 physicians have time to secure alternate employment. While ADHS understands the concerns of providing a reasonable time frame within which a J1 waiver physician could seek another eligible employment site to fulfill the remaining service commitments, ADHS does not intend to impose a blanket requirement of a 90-day notice for termination for cause. A 90-day requirement may not be applicable to certain causes for termination, especially if it has a negative impact on patients' health and safety. In general, however, nearly all contracts we receive here at ADHS have terms that include a period for cure and a period for notice. And then, oops. Service monitoring questions. First question, how do you measure the 40 hours per week requirement for MDs? For the federal requirements, the J1 physician must work full-time at an eligible site located in a designated HIPSA, MUA, or MUP. Full-time hours are hours equating to at least 40 hours per week, 160 hours per month, or 2,080 hours per year. ADHS has ensured that J1 physicians are committed to working full-time based on their employment contract. Their employers attestation that they will employ the J1 physicians full-time, and the department's quarterly monitoring of J1 physician services. Encounter summary should be notarized by a third-party notary. Some employers use their own notary who may be biased and have a conflict of interest. A notary only confirms and authenticates the identity of the individual signing the document. A notary does not attest to the veracity of the information on the document, therefore bias is not really a concern. And then we have this question, what is the earliest time that a spouse of an H-1 visa waiver holder can apply for a work permit? This is not an ADHS, a question for ADHS. However, for questions that are related to immigration services, including H-1B, like this one, you may contact the National Customer Service Center, and the number is provided here, 1-800-375-5283, and then there's a separate number for hearing impaired. Nope. I think that's it. So did we get any questions from the chat box? So what we're going to do as our next step is Were there questions?
No questions, ma'am.
So we didn't receive any questions through the chat box, but like I mentioned earlier, if you have any additional questions, then you can, and you didn't submit it through the chat box because we didn't get anything, then you can just send me an email and I can collate that information and send you the response to those questions later. And also, like I mentioned, the webinar was recorded, so we will send everyone the link to the webinar recording. And I think that's it.